My name is Dr. Beatrice Grumberg, and I'd like to talk to you about IBS or irritable bowel syndrome. Hopefully, I'll offer a slightly different perspective. Since 10 to 15% of the U.S. population suffers from IBS, chances are you've heard about it or experienced it yourself. Have you ever had the experience of abdominal pain, gas, bloating, diarrhea, or constipation? Maybe you've taken an antispasmodic, antidiarrheal agent, or a laxative. Perhaps your doctor has even recommended that you take an antidepressant to alleviate your symptoms. My guess is that these therapies have only been partially effective at relieving your symptoms. And that's after you've already seen a primary care physician and a gastroenterologist. Like other functional disorders, IBS has underlying root causes associated with it. And sometimes when we address those underlying root causes, we can achieve better outcomes. What we need to understand is that IBS is simply a waste bucket term. It is a label for symptoms. And when we label symptoms, our therapies are often just Band-Aids. We can do better than this. Did you know that 70% of IBS is actually caused by something called SIBO, or small intestinal bowel overgrowth? This condition occurs when our large intestinal gut microbiota translocate up into our small intestine, which is relatively sterile. There, the bacteria will consume the foods that we eat and expel gas as a byproduct. As you can imagine, this can lead to some very discomforting symptoms. And SIBO itself has predisposing factors. The most common predisposing factor is food poisoning. This could be a debilitating case of food poisoning or one that goes relatively unnoticed or forgotten. Well, that's 70% of cases of IBS. What about the other 30%? Like SIBO, these 30% of cases have underlying root causes. Perhaps you are suffering from food sensitivity or non-celiac gluten sensitivity. Our routine labs do not identify these food sensitivities very well, but there are some functional labs today that with greater accuracy can help identify your food sensitivity. Then there's the case of gut dysbiosis. What we must understand is that we have tens of trillions of bacteria in our gut, and we want to have a diverse, healthy ecosystem. In today's modern lifestyle and standard American diet, we often disrupt our gut microbiota. And in that case, we get overgrowth of certain type of bacteria, fungi, and even parasites. And this leads to gut dysbiosis and causes the symptoms of IBS. As your physician, I would like to partner with my client and together make lifestyle modifications and change diet to address these underlying causes. When we do this together, we ease disease and we put you on a path towards wellness. Let me help you take that journey. Thank you.